Intussusception, what is that?
Intussusception is an interesting disorder which affects children typically between 3 months and 3 years of age, in which the bowel telescopes on itself. The upper piece of bowel thinks the lower piece of bowel is a piece of food and eats it. And much like an antenna, it folds in on itself. The problem is that not only does the bowel accordion on itself, it draws in the mesentery, which carries the blood supply to the bowel. And so eventually, over time, the blood supply to the lower segment of bowel is compromised, and the bowel can actually die.
So in other words, it's an emergency. You don't sit at, and usually you look at a kid that has vomiting and abdominal distension. It's a characteristic.
Yes, typically the child, the parents will notice, has crampy, intermittent belly pain. It will be episodic with periods in between where the child is lethargic or just not in pain. At times, if the disease progresses, the child can be seen to be passing bloody stool or dark red stool.
Red gelatinous stool. Sometimes I call radiologists in to fix it. Is that possible?
Yes. The type of intussusception we're talking about is one in which the small intestines passes into the large intestines. The radiologist can help to make the diagnosis with an ultrasound, which is very sensitive for picking up the disorder. He can also cure the disease by passing a tube into the rectum and doing an enema while he watches on a video screen. He can not only see the intussusception, but he can see it as he forces it backward and hopefully completely reduces it.
If he's not or she's not successful, there has to be a surgeon ready to operate. Is that true?
Correct.
So it's a partnership.
Absolutely. We work very closely with our radiology colleagues. If they are incapable of reducing the intussusception, despite trying at least 3 times, which is typical, we rush the child to the operating room, and we will then manually try to reduce the intussusception. At times, however, we're also unsuccessful. If we can't reduce the intussusception, it indicates that the segment of bowel, which is intussuscepted, is in all likelihood dead. At that point, we resect that segment and put the intestines back together.
And usually people do quite well after that.
They do extremely well.